Hey everyone. Welcome back to Shock Doc Medical. I'm Dr. Raad, and today we're tackling a topic that I know a lot of you, both patients and fellow doctors, have wondered about. Why do some skin conditions just not respond to treatment? Have you ever thought, my cream isn't working? What's going on? Well, buckle up because we're diving deep into the art and science of taking a medical history in dermatology and figuring out why treatments sometimes seem to fail. Let me ask you this. What if I told you that when a patient says, this treatment hasn't worked, there's a whole conversation waiting to happen? Not just about the medication itself, but about expectations, application techniques, and even the emotional toll of having a visible skin condition. Trust me, by the end of this episode, you'll have a toolbox of questions and insights that can help both patients and clinicians get to the heart of the matter. All right, let's set the scene. Picture this. A patient walks into your clinic, frustrated because their skin condition, say chronic eczema or psoriasis, hasn't worked with the prescribed treatment. But what does that really mean? Is it that the medication isn't effective? Or is it that the treatment plan just isn't matching up with the patient's life? Sometimes it's as simple as messy ointments that are a pain to use, especially for older folks or those living on their own. And, believe it or not, non-adherence is a huge part of the problem. Now, here's where we really get into it. When a patient says the treatment has not worked, the first thing we need to do is ask, what do you mean by that? Are your expectations realistic? Most skin conditions, let's be honest, are about control, not a total cure. We need to ask questions like, what is most important to you, to help set achievable treatment goals? It's all about shared decision-making. Let me break this down for you. Shared decision-making is a three-step process. Team talk. Start by explaining that there are alternatives on the table. Option talk. Dive into the details, maybe even using an option grid, a one-page summary of evidence-based choices and FAQs. Decision talk. Finally, help the patient explore their personal preferences and reach a decision, giving them time to consider everything. This approach not only improves patient satisfaction, but also boosts adherence and outcomes. So what should you ask? Here's a list of crucial questions. Expectations. What do you mean by has not worked? Are we talking about complete cure or just a lack of improvement? Time factor. Have you given the treatment enough time? Some treatments need 3 to 4 months to hit their stride. Adherence and application. Did you continue using the treatment? If not, what stopped you? Collection of medication. Did you pick up your meds from your GP after the initial prescription? Specifics of the prescription. Show me what you've been using. It's not enough to know the name. We need to know if it's a cream, ointment, or lotion. For instance, ointments, like a 30 grams or 100 gram tube of a topical steroid, often work better for dry, scaly conditions, but they're messy. Usage technique. Tell me exactly how and when you apply your treatment. How much do you use and how often? Steroid phobia, a common issue. Ask, how long does that 30 grams tube last? Some parents, for example, hesitate to apply topical steroids to their child's eczema because of fear over side effects. Multiple preparations. If you were prescribed more than one topical preparation, are you supposed to use them all at once or sequentially? And where exactly do you apply each one? Demonstration. Has anyone shown you how to apply these treatments properly? Ideally, every patient with a chronic skin problem should see a dermatology nurse. Or if not, the clinician should be ready to demonstrate. Now let's shift gears and talk about the impact of these skin conditions on everyday life. Our skin isn't just a barrier, it's a part of our identity. Whether it's psoriasis, acne, or eczema, these conditions can take a toll on self-esteem, disrupt social life, and even affect work or school performance. Imagine feeling self-conscious every time you look in the mirror. Yeah, that's rough. Some patients even fear being contagious, feeling like a leper because of their scaly skin. For a more objective view, clinicians use tools like the Dermatology Life Quality Index, or DLQI. This is a questionnaire with 10 questions covering how much your skin has affected your life over the past week. For example, it asks about itchiness, embarrassment, interference with daily activities like shopping or even sport, and the messiness or inconvenience of the treatment itself. The scoring is pretty straightforward. 0-1, no effect on life. 2 to 5, small effect. 6 to 10, moderate to 20, very large effect. 21 to 30, extremely large effect. There's also Skindex and even specific tools for measuring itch severity, which is one of the most debilitating symptoms in dermatology. Look, the bottom line is that understanding why a treatment hasn't worked isn't just academic. It has real-world implications. When patients and doctors work together with a clear understanding of what's going on, treatments can be optimized. Maybe it's not that the medication is ineffective, but that it's not being used correctly. Or perhaps the dosage isn't right. For instance, a 30-gram tube of a topical steroid might run out too quickly if not applied as directed, or an emollient might be underused if the patient wasn't given a generous 500 grams tub. And let's not forget the psychological aspect. By measuring the impact on quality of life, we can adjust treatment not just for the skin, but for the whole person. This holistic approach is what modern medicine is all about. To wrap things up, remember, when a patient says their skin treatment hasn't worked, it's a signal for us to ask a series of in-depth questions. We need to explore their expectations, check the technique and adherence, and even consider the emotional impact of the skin condition. By embracing shared decision-making and using objective tools like the DLQI, we can fine-tune treatment plans and ultimately help patients lead better, more confident lives. All right, folks, that's a wrap on today's deep dive into dermatology history and treatment challenges. If you found these insights helpful, whether you're a patient, a clinician, or just a curious mind, please hit that subscribe button, give us a like, and drop your questions or thoughts in the comments below. We're building a community here at Shock Doc Medical, where every conversation brings us one step closer to better healthcare for all. And stay tuned. Next week, we'll explore another groundbreaking topic that could change the way we approach medicine. Until then, I'm Dr. Raad, reminding you to stay curious, stay informed, and keep questioning the status quo. Catch you next time.